Good afternoon, everyone, and thanks for joining us today. In the legislature in Regina, we have Premier Scott Moe and Dr. Saqib Shahab. Joining us on the phone line today is Scott Livingstone, CEO of the Saskatchewan Health Authority, and Dr. Susan Shaw, Chief Medical Officer with the Saskatchewan Health Authority. Both Premier Moe and Dr. Shahab will have opening statements, followed by time for questions. Premier?
Well, thank you, everyone, and good afternoon. The situation in the northwest part of the province continues to stabilize. Today, we are reporting 4 new cases in the far north and 1 new case in Regina for a total of 5. As well, we are reporting 13 additional recoveries. So thank you once again to everyone in Saskatchewan for what you are doing to reduce the spread of COVID-19. It is truly working. And a special thanks to all of those individuals who are working together in La Loche and many other northern communities to control the spread of COVID-19. Tomorrow, we are going to see a few more businesses reopen under Phase 1 of the Reopen Saskatchewan plan. And next week, we will see the beginning of Phase 2. Tomorrow, golf courses and drive-in theaters will be able to begin operations in accordance with the guidelines in the Reopen Saskatchewan plan. Also tomorrow, outfitters operating in areas that are not impacted by current travel restrictions are able to begin their operations. Owners and employees of outfitting operations in the Northern Saskatchewan Administrative District are allowed to travel to their camps to prepare for the season and to secure their premises. Then this Tuesday, May the 19th, we move into Phase 2 of the Reopen Saskatchewan plan. And businesses that are able to begin operation in this phase include many retail businesses, shopping malls, select personal services, including hairstylists and barbers, registered massage therapists, acupuncturists, and acupressurists, as well as public markets and farmers markets. Of course, these businesses will also have to follow physical distancing guidelines for the safety of both their employees as well as the customers that may frequent their locations. Earlier today, our Minister of Agriculture, David Merritt, has announced a $10 million investment in additional funding to help livestock producers manage the market impacts of COVID-19. $5 million of these funds are earmarked for Saskatchewan's share of the costs associated with participation in the National Agri-Recovery Set-Aside Program. And the other $5 million is to reduce premium costs under the Western Livestock Price Insurance Program. Our livestock industry is one of many sectors that has been hit hard by the impact of the pandemic and the resulting impact of the pandemic on our cattle markets. And this assistance is being provided to offset a portion of that impact. Finally, as you know, our testing numbers have fallen in recent weeks. In one sense, and I've stated that this is some positive news because it means there have been fewer people with contacts to trace and fewer symptomatic people. Still, we want to see more people being tested to ensure that if there are COVID positive cases out there, that we are finding them. And we have the opportunity then for them to self-isolate as well as the opportunity to test their contacts. That's why myself and the Saskatchewan Health Authority have asked the Saskatchewan Health Authority to broaden the criteria for people who will be tested, which in turn should increase our number of tests. And one of the new expanded criteria of that testing will soon be available to any Saskatchewan resident working outside of the home. So I'll let Dr. Shahab explain in more detail some of the expanded testing criteria, as well as a more detailed synopsis of our numbers. Dr. Shahab?
Thank you, Premier. So I have several things to go over today, so I'll start with the case numbers and just reinforce that while we have 4 cases in the north, we also now have 1 case in Regina. So, I know we were quite happy with the fact that there weren't any new cases in the central and south parts of the province and Regina for some time. But the fact that we have a new case is a reminder for all of us that COVID doesn't go away. It may hide for a bit and then come up at any time. So that's why we all need to do what we're doing around physical distancing to allow businesses to reopen in a safe manner while keeping COVID at bay as much as we can. And in terms of the case in Regina, the case was actually in hospital, and because of that, there is an investigation happening in the hospital in Regina, and at this time, there's no evidence that there's any transmission. The investigation is in the Pasco Hospital, but again, it's similar to the event that happened in PA, where there was no further transmission in the hospital setting, but obviously, as in terms of due diligence, staff, and if there were any patients who potentially could have been exposed, will be reviewed, assessed, and if required, tested. So this is just an example of that there's no outbreak, but there's a case within a healthcare setting, and investigations are happening in terms of could others have been exposed, and likely the infection may have been acquired before coming to hospital, so there'll be an investigation in the community setting as well. In terms of other announcements, there's going to be a public service announcement for Lac La Ronge, because there was a case in that area who visited on several dates, visited the Fire Creek gas station in Saskatoon, a co-op bar in La Ronge, a Robertson store in La Ronge, a supermarket in La Ronge, and a gas bar. And so several sites which will be in the public service announcement. And the reason that this public service announcement is being given is because obviously there's no record of who may have come on those dates. So this is just a flag for those who may have gone to these locations on those dates to just monitor the symptoms, and if they have any questions or concerns, call public health in terms of testing and other advice. And so this is again an example of why a public service announcement is given when there's a single case, but there's may potentially be exposures that the public needs to know of. And the case was involved at a gathering that may have been larger than 10, so there's obviously an investigation happening there as well in terms of further transmission. So this again is a reminder that, I think we've had some interest in people getting together outside of the virtual household, but again, the risk remains, and we really need to try to avoid any gatherings that can result in transmission beyond our immediate household, or if we feel comfortable, 2 or 3 friends or 2 or 3 virtual households. So I think this is again a reminder of why we keep repeating those things. Moving along to testing. So obviously, our testing numbers were around 300 to 600 a day, with high levels of testing obviously in La Ronge around the outbreak areas, but lower in the rest of the province. And people weren't coming forward, partly because they may not have been symptomatic, and partly because of other reasons in terms of symptoms are very mild. So the expansion in testing really is designed to increase our testing numbers throughout the province, and so that will obviously inform people who may have very mild symptoms or have other concerns, especially as people go back to work. We really want to encourage, as businesses reopen, if employers and their staff have concerns, they can and should get tested, even with mild symptoms or even no symptoms if they have concerns. And this will allow businesses to reopen in a safe manner and get testing at a very low threshold. There's also testing that is going to start for patients who are now that a lot of other healthcare services are starting, for patients who are now accessing services that may have been paused or that are otherwise restarting. For example, people who are going to start cancer care or chemotherapy, because immune suppression can increase the risk. So testing will be offered to all patients in that category. Caregivers of those with compromised immune systems, homeless and vulnerable populations, others who may be admitted to hospital, including expectant mothers. And all of this will do 2 things. It will reinforce the role of testing in informing if there's low levels of COVID activity throughout the province, and also, of course, inform us about the value of testing in situations where the virus transmission will be low, but the risk to vulnerable populations may be higher. And of course, we'll be studying that and evaluating that in terms of how useful this is in going forward, and should it be expanded to other groups, or the testing strategy, should that be tweaked based on what we learn over the next few weeks with this expanded testing strategy. And then finally, I just wanted to remind everyone that the weather is great for the May long weekend. But this is really a time to enjoy the long weekend, but plan activities primarily within your household, within your virtual household. There's lots of green areas close to where you live, and try to enjoy the outdoors close to where you live. Boat launches may be open near where you live. But please do remember that the restrictions on gathering size do remain in place. and practice all the preventive measures we talk about: washing hands frequently, practicing physical distancing, limiting contacts outside your virtual household, and of course, as playgrounds and other equipment outdoors is still off limits. So please, keep your children away from those, especially when there may be more people outside. We really don't understand the risk from outdoor equipment, and we just want to be cautious for the time being around that. And as residents can visit cabins in the southern half of the province, stay on your property, try to take your supplies with you, and minimize traffic to local stores. And if you have to go, only go for essential items. And of course, people in the northern Saskatchewan can't visit the cabins at this point till the travel restrictions to the north are relaxed. And then my final comment is that just because we have COVID doesn't mean everything else has gone away. And maybe some things that are transmitted because of close contact may have gone down, and we'll have to look at that. But certainly other risks haven't gone away. So we did have a case of hantavirus reported this week from the central part of Saskatchewan. That's again a reminder. Usually this time of year we give a reminder for everyone just for the long weekend that when you are opening cabins or sheds or garages after a period of time, and just be cautious of opening doors and windows, letting the air circulate. Don't sweep things that generates a dust. Use wet mopping methods to clean things. And if you see, signs of mice droppings or dead rodent, use bleach and other procedures. There's good information on our website. But just, some precautions around hantavirus. And just a reminder that, while we've been focusing a lot on COVID, everything else is still there, and we just need to take the usual precautions in this case when we're opening cabins up after the winter season. So I'll stop there, and if there's any questions.
Thank you, Doctor. Thank you, Premier. We'll take our first question from the phone line operator.
We have Mark Smith with CTV.
Hi. Did the new case in Regina originate at a retirement home? We've been hearing that from some people. And also, how many healthcare workers are isolating as a result of that case at the Pascal Hospital?
So the person was in an assisted living facility, and public health is investigating. But because it wasn't like a long-term care facility or personal care home, there may not be many close contacts, but that investigation is ongoing. The case was notified yesterday afternoon, and so that investigation is ongoing in terms of are there any exposure in the community setting. In terms of the hospital setting, my understanding is that out of initial 60, there's 20 potential close contacts who are healthcare workers who may be assessed further. But we have to remember that over time, that list comes down very quickly because healthcare workers are using masks most of the time. And once you go through the list, it may not result in many close contacts, just like in the PA hospital. And I'll maybe pause and see if Scott or Susan had anything to add to that.
So the only thing I would add is to just reiterate Dr. Shahab talking about that the investigation is still underway. We have the team on the ground, medical health officer and team have traced it down to a number of contacts inside the facility, and we will be testing all of those as well as residents of the special care home, it is an independent supported living facility, not a care home.
Follow-up, Mark?
Yes, Alberta has allowed restaurants to open again as part of its reopening plan. Is Saskatchewan considering moving up the date for restaurants to open in the province?
I believe restaurants are part of our phase 3 of our Reopen Saskatchewan. We've been actively engaged with restaurants and we have no date set for that as we sit here today. But although we will be discussing that date in the days ahead, I would presume. But we have been in touch with the Restaurants Association as well as individual restaurants on what exactly the business operations will look like to ensure the safety of not only the staff but to ensure the safety of the patients. So some of that work has been going on for a period of time now and is actively going on now. But we have not decided a date on restaurant reopening. However, we will be watching in other jurisdictions how their restaurant reopenings go, as it may help us in bumping the date of not only restaurants but maybe phase 3 up or back a few days here in the province. Anything to add, Doctor?
Yeah, the only thing I'd add is that we want to go in a phase systematic way. So phase one was, mostly medical services and some outdoor recreational activities. Phase two is other retail environments, and that's on the 19th, and other personal care services. We really want to give at least 2 weeks and possibly longer in between phases just to make sure everything is quiet. And this also reinforces the fact that the more we can do everything else around avoiding mass gatherings and practicing physical distance, the more successful we will be in moving ahead with our phases, because that has to happen. We have to be diligent and disciplined about physical distancing, avoiding large gatherings, and that allows us to then move cautiously and in a systematic way with our future phases as well.
I would just add this, whether it's, one of the phases in the Reopen Saskatchewan plan, or whether it's, travel restrictions that have gone on and maybe looking at taking off in certain areas, any of the public health orders that are there, it is always our goal to flatten the curve to a level where we can remove some of those orders and still conduct our day-to-day life as safely as possible so that we're able to flatten this curve. And then we must remember that the goal is not to eradicate the virus, but our goal is to flatten the curve to a level to ensure that we are not risking large-scale outbreaks and not risking the capacity that our healthcare system can manage, and ensuring that we are, for all intents and purposes, doing everything we can to keep this virus out of our most vulnerable populations, most notably our long-term care homes and those that are immunocompromised. So the collective success that we have had is largely on each of us for the very high level of personal responsibility that we have put on our physical distancing practices. And this is, I think, even more important as we start to reopen sectors of our economy here in Saskatchewan, because if we can continue focusing on that physical distancing and not attending these gatherings that might be larger than 10 people, not attending gatherings where we might feel that we are unsafe. If we are not feeling well, we're dialing 811 and we're staying at home. These are all things that we are doing as individuals that are leading us to this collective success that we are having in many areas of the province. And I would say that the success of our Reopen Saskatchewan plan, the pace at which we are able to move through reopening our province, and don't make any mistakes about this, our goal is to actually remove these restrictions that are in place, but we can only do so when we are achieving that collective success across the province or in the regions where these certain restrictions may be in place. So the goal is to remove these restrictions, but we can only do so when it's deemed safe, and really it's only deemed safe when we are doing what we have been doing for the large majority of us in this province have been doing, so that we have the success that we have today.
We'll take our next question from the room here. Steph?
Yeah. Mr. Premier, the town of Priestville says it was given a one-day notice before its emergency services and acute care was suspended. Okay. Is one-day notice an appropriate amount of time? I
wasn't aware of that, that there was one-day notice. Scott may have a comment with respect to that, but if I go back a number of weeks, it's my understanding that the Saskatchewan Health Authority had done a fairly inclusive and in-depth proposal as to what their one province strategy was with respect to how we are going to manage COVID cases here in the province, and how we are going to ensure that we have a health system that is prepared for the most challenging circumstances that may come at us, but most certainly was making every attempt to continue with providing services that we can in the province. So I'm not aware that they were provided with one-day notice, or I'm not aware of what any of the communities were provided in time frame. But Scott, you may have some comments with respect to when that original presentation that you made was, and as to how many emergency rooms may be closed temporarily at this point in time, and where we're going with that effort.
Sure, thanks, Premier. So just to highlight, across our response to COVID, and now with our reopening of the healthcare system scheduled for next week, every single resident of this province has had to make sacrifices with respect to what they're experiencing from everyday healthcare services and what they look like through this pandemic, as we plan to both respond to the COVID outbreaks, as well as our response to reopening the services that people in this province need. With respect to specifically to the alternative care conversions, the LC conversions of those 12 rural facilities, back in April, before we released our plan publicly, the defensive strategy, which has never changed, we had conversations with each and every municipal leader in the 12 affected communities, advised them why this was being done, what was being done, and when it was being done with respect to the 4 to 6 week time frame, where we were going to implement it in 3 phases. So that happened before we even made the public announcement, and then a few weeks later we announced the offensive and defensive strategy, which we've updated everyone on a regular basis as things proceed. So it's important to understand that the selection of these facilities was multifactorial, and it proceeded based on a number of factors, including how we protect those long-term care residents and facilities where we have an integrated facility where we have both. How we cohort staff, as you know, we're cohorting staff to protect, again, our residents and ensure that we're not bringing in COVID by having people work in multiple facilities, as well as, and importantly, building capacity. At the time, it was presented to build our COVID surge, but now it's a dual capacity issue. Is we also need to build capacity to reopen the healthcare system and prepare our system for both what we will experience from COVID over the next few months and potentially years, but also what we will experience as the system reopens itself. So with respect to, the process that was involved, we did involve those. I mean, we didn't call the communities the day before it happened, but all the community leaders were aware of it happening. And we proceeded based on the schedule that we presented publicly.
Follow-up, Steph?
Yeah, to Mr. Livingstone, there's a big difference between presenting communities with a policy that takes effect over 4 to 6 weeks and then letting them know the specific date and giving them some prior notice to say, your ER is going to be temporarily closed on Wednesday and you're telling them on a Tuesday. So, why is a 1-day notice appropriate for a rural community, especially at this time of year when many rural residents are out in the field seeding?
Well, a good question, Steph, but I guess how I would answer that one is the health system deals with temporary closures of services all over this province all the time with short notices because of staffing difficulties and other issues. So in many cases, we're not able to prepare or tell communities what's going to happen on a temporary basis in advance. In this case, we did. And with respect to, we also haven't left them in the lurch. We have emergency services all over, particularly the Southeast, which is impacted more than others with respect to these conversions. And if we go to the Southwest and look at what facilities are providing that type of care and the access to that care in the Southwest, the Southeast is still in a much better position. And we did not go out and randomly select these facilities. They were geographically selected so that we could ensure that both our ENS personnel and these communities were all close to other ER facilities that were open closer to home. And that is why this was happening. So with respect to, the day-to-day activities of the system, we often don't have the opportunity to consult with communities when we see these short-term closures. There's very well-organized protocols to do it, and we've done that in this case.
We'll take our next question from the phone line.
We have Guy Quinville with CBC.
Oh, thank you. My first question stems from the recent Sundance ceremony at Beardy's and Okamas's Cree Nation. Today, Indigenous Services Canada said that decisions on traditional ceremonies like this should be postponed or cancelled, that decision should be made by community leadership alone. How do you respond to that, Premier Moe, given your comments yesterday, and do you stand by your stance that Indigenous ceremonies should not be exempt from the provincial public health order?
Of course, they should not be exempt from the provincial public health orders. No one should be exempt from these health orders because, quite frankly, no one is exempt from the virus. And that is the world that we are living in here today. That being said, there is an opportunity here for us, and I've reached out to Bobby Cameron, Chief Bobby Cameron, this morning of the FSIN to open up an opportunity for the public health to work with the FSIN on looking at these types of cultural ceremonies in the same way that we're looking at some worship services and some religious ceremonies. And is there a way for us to work together to come up with a set of parameters where these ceremonies may be able to actually be conducted in a safe manner and be conducted in compliance with the public health orders that are out there. Now, there is no guarantee that we can come up with that set of parameters, but we should try, and we should attempt to do that collectively. So that opportunity is there, and I've been reaching out to Chief Cameron here this morning. With respect to the comments of the minister, as well as Indigenous Services themselves around these particular events being exempt from public health orders, that simply cannot be the case. The reason these public health orders are in place is so that we are able to flatten the curve, so that the provincially delivered healthcare system can manage the healthcare needs that may be coming at it due to COVID, as well as the other needs, the other healthcare services that we are being provided. All residents of this province, whether you live in an Indigenous community or otherwise, you will use the provincially delivered healthcare system that is here. The public healthcare orders are in place so that we can manage the spread of this virus, so that our healthcare system can manage what may be coming at it should we have a large-scale outbreak here in the province. So most certainly, the public healthcare orders need to be adhered to. They need to be adhered to in every community across this province, wherever you live.
Follow-up, Guy?
Yes, thank you for that. This is also for Premier Moe. I'm speaking to a northern resident who lives in the community of Cold Bay. I've also spoken to Chief Francis Iron of Canoe Lake Cree Nation. They both feel the same way. They feel like the checkpoints blocking travel into and out of the north are poorly run, that the rules are being inconsistently applied, and they point to the fact that when places in the south, like Saskatoon, had a number of cases, there were no checkpoints put in place there. They feel like northern Saskatchewan is being treated to a different standard than the rest of the province. And they feel like the Saskatchewan government has displayed a lack of trust in northerners. As Chief Iron said, they feel like, quote, caged animals right now. Mr. Premier, what do you say in response to these criticisms?
Well, it's unfortunate, and I respectfully would disagree with those comments. The checkpoints that have been put in place first by the communities. Second, when the provincial government moved into this space, they did so only with the consultation of virtually all, or I would say all, of the northern communities, as well as the minister, to my understanding, has been on weekly calls with the MLTC band leadership, as well as the PAGC band leadership, as well as other Indigenous leaders throughout the north, as well as Chief Cameron, and all of the northern mayors. And so the consultation has been very broad. In particular, more increased consultation with those individuals in the Northwest specifically, as that is where the heart of this virus spread is at the current moment in time. So those comments are unfortunate, as the checkpoints are in place with the collaborative work that has happened between our public safety agency as well as the local communities. So that is unfortunate. In saying that, I would just say this. It is our true intent that these checkpoints will be removed, and the sooner that we are able to stop the spread of COVID-19 in those communities and get our situation in this province's northwest to a much more manageable situation, we most certainly want to remove those checkpoints. The goal is to not have those checkpoints in place. They're in place to settle the spread of that virus so that it does not spread to other northern communities in the central and eastern portion, as well as southern communities, and quite frankly, to slow any of the spread that may come from some of our southern communities into the north as we enter, for example, the May long weekend, when we know there are a number of people that want to use and go up and explore either their cabin or some of our great northern environment and lakes that we have there. So these checkpoints are in place through consultation with the communities throughout the north. They're in place for the safety of all Saskatchewan residents, and it's most certainly our goal to settle down the spread of this virus, get to a more manageable situation, and actually remove the checkpoints so that we can have all of our Saskatchewan communities traveling back and forth. There are people that want to move both ways with respect to these checkpoints. So unfortunate comments. I don't agree with them, but always willing, as the minister, is continuing to work with not only Chief Iron, but all of our northern leaders in ensuring that we are doing what we can to control the spread of COVID-19 in the least invasive way.
I'll just add quickly, we also have Marlo Pritchard, President of the Saskatchewan Public Safety Agency, on the line. I'll put it to Marlo Pritchard on the line for the operation of northern checkpoints in consultation with communities.
Thank you very much. Absolutely. As the Premier mentioned, we have been ongoing conversations, and we continue even as late as this morning. We're working through some, I would say, rub points in regards to freedom of movement and accessing and understanding of the public order restrictions. And we're hoping to have a more consistent messaging at those checkpoints. We do want to say, though, that a lot of those checkpoints that we are manning, SPSA, are manned by staff from that live in those communities and have a very vested interest in those communities. So we're very aware of the situation, and we're working with all of the community leaders to ensure that the safety of all these communities and all of the Saskatchewan is upheld.
We'll go to our next question on the line, operator.
We have Murray Mandrick with the Leader Post.
By now you're familiar with the results from the innovative research polling, which is obviously favorable to you. Can you speak to what you think it's telling you that Saskatchewan people think you've been doing right? And can you also speak to what you think you have to do better as we move towards phase 2 and 3 and the reopening?
I know. That's actually the toughest question I've had here over the course of the last number of weeks. What we've been doing well, I think, is talking to people, consulting with people, and those conversations aren't unanimous. And the previous question around northern checkpoints would be an example where there isn't unanimity among all of the stakeholders and all of our local leadership when we come to these decisions. But we do take the decision that we feel is the correct decision, and we move forward with it. And these are not easy decisions when we are, through consultation with Dr. Shahab and his shop, putting in some fairly extreme public health measures on the people of this province. And just as challenging is how do you unwind these public health measures, if you will, and start to reopen an economy. No one has ever done this before, not just in Saskatchewan, but to my knowledge, not even in Canada have we had this type of a challenge when we are trying to safely open an economy with this virus that is floating around, and we know we're going to have infections. Quite likely we're going to have more cases of COVID-19 in the days ahead than we have now. So, what have we done well? I think we've been very selective with the public health orders that have been in place, and for that and effective, I would put forward as well, and for that I give credit to Dr. Shahab and his team in the Chief Medical Health Officer's office here in the province. I also give credit to a large number of ministers in the government, Jim Ryder, Laurie Carr, Jeremy Harrison, Donna Harpower, a host of ministers, many others, as well as the MLAs on both sides of the House that have been talking to people across this province and providing the relevant ministers with information that I think has helped not only what the response is here in the province, but has also helped the response be effective in getting this virus in a box, so to speak, and we have done that quite effectively. Now we have, what do we need to do, or what do we need to do better? As we look ahead, we're going to reopen this economy. And we're going to have these localized outbreaks, if you will, whether they be in a facility or a community or a region of the province. And we need to test better. And we see the start of a plan on how we are going to increase our testing numbers here in the province. We need to do more testing so that we can jump on these cases sooner and have a lower number of people to actually contact trace, and ideally a lower number of people to isolate. And in doing so, we should be able to have a smaller our outbreaks should be smaller in nature and reduce the risk of them actually expanding to be a province-wide outbreak. And we've seen what has happened in places like Montreal and New York and different places in Ontario. When that outbreak becomes too large, it's much, much more difficult to manage. So what can we do better in the future is our testing, likely our contact tracing. As we open the economy, we're going to have not only provincial travel, interprovincial travel, travel within the province, of which we also have a restriction on travel today. We're going to start to have some travel, quite likely, in and out of our province, and we're going to have to work more collaboratively with other provinces on how do we contact trace under that environment. And ultimately, as the economy opens up even more, there's going to be some additional international travel, notably with the U.S., and we're going to have to work with our federal government on how do we contact trace as that starts to increase. We just had a Council of Federation call with all the premiers where we were discussing just those items. How do we look ahead 1 and 2 and 3 and 4 months on our contact tracing, ensuring that we are doing the best work that we can collaboratively across this nation so that we can follow individuals. There's a few apps that are out that some provinces are using that I think show some promise, and so there's opportunities, I think, for us to continue with that conversation and, quite frankly, do a better job at reducing the impact of those localized outbreaks and even further reducing the numbers that are affected by them. This is the new normal that we live in as public health and government until such time that we actually have access to an effective vaccine. That's a short answer to a very long question, Murray.
Follow up, Murray.
Can you expand a little bit on what better testing, better tracing means? Does that mean hiring more people to do more testing? Does that mean in terms of or more tracing, I should say? Does that mean more random testing that you have been reluctant as a government to do to this point? And just as a follow-up or a clarification to Mark Smith's question, you keep talking about 2 weeks between each stages. Are we just to assume that that means that phase 3 you're looking at sort of the second or third week of June because you kind of talk around it, but it's never been pinned down to a date, so I guess I'd kind of like to see it pinned down to a bit more of a date.
So 2 weeks would be the incubation period of the virus. Dr. Shahab might have a little more to add to that. We just honestly haven't landed on a date for phase 3. We haven't discussed it at any length, but I think we will once we safely get into the working elements of phase 2. Quite frankly, much of our resources have been, and Dr. Shahab may add to this, but have been working with those businesses that will be reopening in phase 2 as to what a safe reopening practice and procedures and parameters look like in each of those sectors of the economy. And it's a lot of effort and all hands on deck in that work, and we'll very quickly begin to focus on phase 3 and what parameters we need to have in place and some of the finer tuning, if you will, of those sectors of the economy that will ultimately open in phase 3. So quite frankly, I just don't have a date, and that's simply because we haven't we just haven't spent the time discussing what that date may look like. But again, I would say that we want it to be as soon as possible, but it needs to be safe and limit the opportunities for this whole reopen phase in some ways to be derailed, even in areas and communities of the province. Testing, I would just say that Dr. Shahab will have more to answer on this as well, but I don't think broad-based testing just in the population is tremendously valuable unless you're coming with a serological test of some type, which we're hopeful to have access to in the not-too-distant future. But there is places where broad-based testing, to some degree, might be effective, and that's in some of the higher-risk areas of our economy. So if there are work gatherings, for example, where there is a larger number of people as required, and maybe we could do some random testing in those particular areas to try to identify if there's a positive case at any point. You might catch it a little sooner than you would, and we have the capacity. We have the capacity to do this, and so I've asked the SHA to look at how we could use this capacity to the best of our ability, and they've came up with the start of that plan here today. But Doctor, would you have anything to add to that?
Thanks. So I just want to maybe speak a bit about how testing was rolled out and what the response was, and and a bit about how, as we move forward, how that could work. So our modeling colleagues have used the term hammer and dance. So, in February, March, there was obviously a lot of concern, a lot of fear, and, we went into lockdown very quickly, and everyone complied with that, and that showed results. And testing, of course, it is flu season. People are coming back. People are stepping forward to get tested, and we had, fairly high rates of testing, around that 800, 900,000 almost a day, which was also very important. We have to remember that even then, our test positivity rate was only around 1 to 2%. So, which means that even during that initial period of time when we had a high RT of around 2, primarily due to people coming back and some mass gatherings, our test positive rate was only around 1 to 2%. And then we had a sustained outbreak in the north west, where testing was actually done household to household, where in some cases younger adults and children were found to be positive while asymptomatic, and that had value in terms of case contact investigation combined with testing containing the outbreak, and we see the positive results in the LOSH. Now what we are seeing is we are seeing some complacency and some impatience, both with testing and with complying with the existing orders that are in place. So in terms of complacency, we do really want to encourage anyone with any symptoms or any concerns as businesses reopen, and people will have concerns. I think some people will think, am I safe? Is this slight scratch in my throat due to me being exposed? But we want to encourage people who are now re-entering the workforce in settings in a very different business model to really seek out testing if they have any concerns. And if we keep seeing a low test positive rate, we will be very reassured that the virus is at bay. But we still have to continue practicing physical distancing and other precautions. And if we see an increase in testing rates, we will be able to understand the settings in which that's happening. Is it related to a particular business or a sector, and what can be done to improve? So testing is also beneficial for the person who tests positive, but also informs the exposure setting and what feedback can be provided to maybe improve the processes. And about 4 or 5 weeks ago, we did see a bit of a signal in people who were testing positive that they were more likely to be shoppers versus non-shoppers. So there was a bit of a signal. We reinforced the practices. The industry really, which was really doing very well, reinforced physical distancing, that only one person per household. Some people are unhappy that why can't we all go into a store, but that was enforced. And we saw the results that our numbers went down. There was no signal anymore from going grocery shopping, for example. And that's kind of the reinforcement, the positive feedback loop that is very important, that will inform us as we move forward testing. And then what can we do based on what we learn from that to further inform our behaviors and our practices to keep our numbers low.
I would say just maybe one other item, Murray, on what we can do better is to communicate with the people of the province exactly why we have been successful thus far for the most part. And it's because of what individuals are doing. Our collective success, I've said this many times, but our collective success is largely due to the fact that the vast majority of individuals in this province are adhering to the public health orders. They are keeping their distance. They're not going into areas that are populated unnecessarily. They're not going to the grocery store unnecessarily. They're keeping their hands clean, and they're doing all of the right things to really stop the spread of COVID-19. That needs to continue as we reopen this economy, and it's on us in many ways as a government to communicate again exactly what those successful parameters and actions are, and to thank the people for what they have done thus far, because it is by far the largest factor that we're able to sit here today with the number of active cases that we have, and more importantly the low number, albeit each of them missed dearly, but the low number of fatalities that we have in this province.
We'll take our next question from the phone line.
We have Adriana Christensen with CJME.
Hello, yes. This question is for Dr. Shahab and perhaps the Premier. There are reports the CFL is considering using hub cities to allow teams to play in just 2 cities, one in the west, one in the east. What are your thoughts on the possibility Regina could be one of those locations for the West down the road in the middle of the summer?
Are you a Rough Rider fan?
I can speak to it. Or do you want to speak to it?
Go ahead.
I think we have seen. So I've personally not actually looked at this in any detail, but we know that there's interest in many settings to have, for example, sports start in a way that they may not be spectators, but it may be televised. And of course, we've heard from other countries, not in North America, that they have tried to do that in a way that even the players behave very differently. They are, they practice physical distancing and isolation while they're in their hotel rooms. Obviously, there is contact while playing, and so that can happen in a way that there would be some risk of transmission in those settings to players. You can minimize the risk to, obviously, there won't be any spectators, but there would be people who would be organizing the venue. So sometime in the future, that could be something that may be done in a way that would not be no risk to the players. It would be some risk to the players, and maybe of some value in terms of entertainment and economic activity. So I think those kind of things have to be looked at, because the other thing we have to understand is that as we go through our reopening phases, I think we still need to understand if and how we can open up to those kind of large gatherings which we enjoy, whether it's sports, whether it's a cultural event, a music festival. I think that still is a big question mark in terms of how and when can those events be done in a safe manner. So obviously we're looking very closely at jurisdictions where this has been done from the public health side, but obviously there's an economic side and other factors that you may want to speak.
Yeah, there's a number of professional leagues that are looking at, is there any way for them to salvage in some way, shape, or form a portion of their season? Obviously, it is increasingly looking like, for the most part or for the foreseeable future, it wouldn't be an environment where fans would be able to attend. We have, for example, the NBA. We have the lacrosse league, where our Saskatchewan Rush play out of the city of Saskatoon. We have the NHL. This came up on our Premier's call earlier today, where Doug Ford is still hopeful that the NHL could operate this year as he feels the Toronto Maple Leafs have a chance, just like they last did in 1967. But the CFL, again, is the league of our beloved Rough Riders. I have not been in discussion, as I don't believe either of us have been, with the CFL on any proposal that would be there to salvage a portion of this season, playing out of maybe a couple of cities in the nation. But I do know that if that was to be under consideration, there would be a collaborative work done by the league, the team, the community, the province, and the chief medical health officers, likely at the provincial and national level, to ensure the safety of the players and limiting their risk to exposure to this virus, as well as many parameters around those that may have to be in the stadium. But to this date, we just haven't had those discussions.
Follow up, Adriana?
Oh, that's good. So my second question relates to the expanded testing. Can you, I guess, clarify the reasons for deciding to expand testing to at-risk populations, and why those groups were chosen now as the province begins to reopen?
First and foremost, because they are at risk, either at contracting COVID because they're in an environment where maybe there's a large number of people around, or healthcare workers, for example, that may be at a heightened risk than many others in our community, or they may be at risk of developing more severe symptoms should they contract COVID-19, and so we're narrowing in on those populations, if you will, for good reason. Those are areas where you're either at higher risk of contracting COVID-19, or you're in an immunocompromised or an elderly population where we don't want you to have COVID-19 because of the ultimate consequences. You have anything to add to that, Doctor?
Yeah, so I think, and I mentioned this earlier as well, that while we are expanding testing, we're obviously going to be evaluating how the testing behaves in various high-risk populations, and also how well does the testing behave when we have very low rates of virus transmission, because we have already seen in a few instances that we some false positive test results that are very rare if the virus transmission is high. Most tests are true positive, but when you have very low virus transmission, you sometimes have to retest if it's a weak positive, and in a few cases that has come back as negative. So I think when you test when virus transmission is very low, obviously you may protect people at higher risk by finding a situation where someone was COVID positive when they had no or minimal symptoms and are high risk because they're starting chemotherapy, for example. But at the same time, we also understand that if virus transmission is very low, you can also have, a significant number of false positives that requires repeat testing. So we will have to also evaluate, how the testing works in our current environment, which is low but not zero COVID virus transmission in most of the province. But then as time goes by, obviously, we will have to continuously adjust that if we were to see, for example, virus transmission increase again.
We'll take our next question from the phone line.
We have David Baxter with Global.
Hey there, this one is for either Dr. Shahab or Mr. Livingstone. Just with the Pasqua Hospital case, looks kind of similar to Victoria Hospital when there was one case there and an outbreak was declared. Why isn't there an outbreak declaration in Regina?
Yeah, so I just want to flag that, I think this is just done because of the principles of being transparent, but it's a preliminary test. It's being reconfirmed, and like I said earlier, when you have a low transmission setting, a preliminary test positive doesn't mean that the test is positive. It needs to be reconfirmed sometimes if it's a weak positive. So different from the presumptive test and the confirmatory test. It's a weak positive test that has to be reconfirmed, but at the same time, an initial investigation is started in the hospital and community setting. But that repeat testing is also important in low transmission settings. That's currently happening. But at the same time, it's just like if you have symptoms and you go for a test in the community, you don't wait for the test result before isolating. You isolate right away. As soon as you have symptoms, you isolate. You don't go to work. You don't go out and about. You wait for the test result. If the test is negative, you still continue to isolate till your symptoms go away. And you've been asymptomatic for 48 hours. And if your test is positive, you then have to isolate for up to 14 days, and then you're cleared by public health. And that also is because if you have mild symptoms, the test can be a true positive only if 50% of the time. So I think that's something we need to keep remembering, that testing while it's being expanded is not, the answer to everything. You also have to physically distant all the time, isolate if you have any symptoms, till your symptoms are gone for 48 hours, or if the test was positive, 14 days have elapsed and public health has cleared you. And I think the same principles apply to, in this instance, an initial test that's weak positive that's being investigated, but at the same time, all the steps around contact tracing are being taken while the test may be run again. Scott, would you have anything to add to that?
No, nothing more than what you said, other than, the investigation is still underway, and one of the things that they're still investigating is where, in fact, the patient developed the disease. It's not confirmed that it's an in-hospital case, and they're looking both in the community, the facility or housing unit that she comes from, as well as the hospital, and that will evolve as more contact tracing occurs over the next 24 hours.
Follow-up, Dave?
Yeah, more completely different question. This one's for the Premier. You previously talked about some security concerns with hosting legislative sittings over Zoom, but with the House leaders talking about bringing back the legislature, I'm talking about some kind of social distancing seating plan, but we're seeing the House of Commons, the U.S. Senate, many other different governments using Zoom for their meetings. Has your opinion changed on having legislative sittings or committees by Zoom?
No, but we are looking at some opportunities, and the House leaders are in discussions, to my understanding, including this week, on, is there an opportunity for us to come back for some modified version of the session, if you would, so that we would be able to pass a budget on behalf of the people of this province, and that budget would be able to have some legislative scrutiny, which this budget deserves. As I said, it is a budget that was already investing heavily in communities and people and families across the province, and with $2 billion of infrastructure investment committed to over the course of the next 2 years. Added to this, it most certainly is a budget that the people of this province, I think, want to have a look at. They want to see how this particular budget is investing in their community, and we're more than willing to put together some degree of some type of a modified session plan, if you will, for that to occur.
We'll take our next question from the phone line.
We have Ashley Martin with the Leader Post.
Hi, just going back to the case of the Pasqua, can you give more clarification about why an outbreak isn't declared? I understand you said you have to wait for, there could be false positive testing and all of that, but it does seem to be quite a lot, quite similar to the case in Prince Albert where an outbreak was declared based on one patient. So why not now?
So we have, after the Lloydminster experience and the declaration PA, we have clarified our outbreak definitions, and if they aren't on the website, I'll confirm they should be on the website shortly. And the outbreak declaration has two purposes. One is that in a long-term care facility, for example, if you have one staff member or one patient in a closed institution, by closed we mean that the residents are there, they may get over time new residents coming in or either going to hospital and coming back, but it's a closed institution with a dedicated staff who aren't working somewhere else. So in that closed institution, even if we have one case, it's not really an outbreak because an outbreak is 2 or more cases, but what the outbreak notification does is it puts in extra procedures and protocols above and beyond the very stringent protocols we already have. Those stringent protocols are temperature checks twice a day for staff working there. Staff for the most part only work in one facility. Visitor restrictions, so very stringent. All these steps are actually higher than what we have even during influenza outbreaks. So these are baseline stringent protocols. But then if you have even one person test positive, resident or staff, immediately additional protocols come into place, which may include testing all staff and residents in that closed institution. So a single case results in an outbreak declaration in a closed facility like a long-term care facility. However, in an open facility like a hospital, it's more complicated because patients always coming in and out. There may be people coming in for short procedures for the same day. The staffing is also more fluid. So in that case, a single case brings the flag up where immediately investigations start in the hospital setting in terms of could there be other staff or patients who are impacted, which is happening. And similarly, if the patient came within the incubation period from a community setting, an investigation immediately starts there. So a single case results in investigation starting, but an outbreak would only be considered if there was evidence of further transmission in the hospital, in which case it would be a nosocomial outbreak or an institutional outbreak, and we did have that in Lloydminster Hospital. Or if there was evidence in the community setting of further transmission outside of the household, it would be a community outbreak. And again, so if we get a single case, for example, who was at home, was a contact of a known case, that's not an outbreak. That's someone who was a contact to a known case. And similarly, when we have a single case in the community who can't name an exposure, that's not an outbreak. That's a single case who acquired an illness in the community. But when we have something like in the northwest of the province, when you have cases that increase exponentially, so in the community setting, it's not just one case or two cases, it's cases which rise exponentially over a period of time. So the definition for a community outbreak is again different, that it's not just one case or two cases, it's cases which are increasing in some cases due to a known contact, in some cases due to unknown contacts, and then that declaration in a community setting puts into place additional measures which may include limiting interactions even among virtual households, enhanced testing and contact tracing, in some cases where appropriate house to house. So depending on the context, why an outbreak is initially declared may be different, and of course what happens may be very different based on the context as well.
Follow up, Ashley?
Yes. We're hearing from nurses that that was the pretty high traffic unit. That person, the patient, had been in the hospital for 5 days and in contact with a lot of staff and sharing a room and things like that. Can you comment on how that is impacting the investigation and whether people should be afraid if they've been in contact with this patient, if they've been working on that unit and things like that?
So I think in many instances we have not found evidence of transmission within the healthcare setting because people are more aware of infection control practices. But obviously we will have to wait for the investigation to conclude, and then we will obviously share those findings.
And we'll take our last question from the room. Staff?
Yeah, Mr. Premier, with the federal minister saying decisions around Indigenous ceremonies like sundances should be left in the hands of local leadership to decide to proceed or not, are you concerned that is sending a mixed message at all?
Yeah, the federal government is sending a mixed message as these comments that have come from Minister Miller, I believe. They aren't actually in line with the Prime Minister, who also said some comments about how we should be able to work together to develop ways to continue with important customs and practices, and for them to exercise or to take part in these customs and practices in a way that abides by the public health recommendations that are put in place. And that's what our offer is today. As I said, I've been reaching out to Chief Cameron. I'll be talking to him, I'm sure, later today. Is there a way for us to work together to set some parameters, and I don't know if we can achieve that, but attempt to set some parameters so that these types of ceremonies can be conducted in a safe manner and in compliance with the public health orders, which do apply to everyone in this province. We're doing precisely this work when it comes to worship services in the province. Is there a way for us to work with the community to hold some type of worship services, if you can, but do so in a safe way with proper physical distancing, and to have some parameters that these organizations would most surely follow. So it needs to be a collaborative effort. There's some work that needs to happen beforehand. But as I said earlier, the public health orders apply to everyone. They always have, and they will continue to.
Follow-up, Steph?
Yeah, to the Premier as well. You heard the SHA's explanation about the notification of some of these rural communities that when their hospital may be shutting down. I would like you to specifically answer, as a rural MLA, we're hearing that some of these communities might have gotten some pretty short notices, even a day, says the town of Priestville. As a rural MLA, is that an appropriate amount of time to say your emergency services are going to be kind of closed temporarily?
Yeah, I won't speak to the specifics of how much time is given when there's a temporary closure of a rural facility, and I think Scott Livingston had spoken to the fact that we have experienced temporary closures of rural emergency services from time to time over the course of the last few decades. Thankfully, I would say through a very focused physician and healthcare team, nurses, as well as other team members, healthcare professional recruitment program, we have been experiencing less disruptions in our healthcare services in general, but in particular in our rural healthcare services. As I know, the year that I was elected in 2011 and the 4 years previous to that, it was a very concerning topic in this province, was access to healthcare professionals in the rural areas. This particular temporary closure, and these are temporary closures, is due to the province-wide planning on how we can address this COVID pandemic. We have an outbreak now in Regina. We had one in Prince Albert. We had one in Lloydminster. We don't know where the next outbreak may be, and I may be using the wrong medical terminology, but we have a case in these facilities where often we see, I think in Prince Albert, we had far in excess of 50, almost 100 healthcare officials or employees that needed to self-isolate for a period of time, and we need to have the capacity to move in and ensure that we can operate and deliver our healthcare services in our province. This is most particularly important as we start to reopen some of the surgeries and some of the healthcare services that we do want to have access to in this province, because healthcare services do need to go on. So it's my true hope that these interruptions will be as minimal as possible, And we will be working with the Saskatchewan Health Authority to ensure that they are as minimal as possible, and also as in number, but also as minimal in time, because these emergency services are in these communities for a reason. The healthcare services that we have in our rural communities are there for a reason, because people require those services. So we'll be following up with the communities as well to ensure that we're working with them. But this is a province-wide response to a global pandemic, and it is all hands on deck, and that includes, and most appreciatively, all the hands that we have in our healthcare system.
And that concludes our time for today. For the media on the line, we have no scheduled availabilities from May 15th to 18th, with the next scheduled media availability on May 19th. We will be providing daily case updates as usual and further updates as necessary. Thanks so much for joining us.